Dr. Jane Wilcox. I'm the Associate Chief of Cardiology here at Northwestern Medicine and the Medical Director for our Center for Heart Failure.
I'm Duk-Tin Pham, Cardiac Surgeon at Northwestern Medicine and Surgical Director of the Transplant and Mechanical Assist Program.
One of the advantages of being a high-volume center, being a center that has excellent ancillary services, excellent partners like kidney transplant surgeons, hepatologists, liver transplants, is that we can take on high risk. So we are growing year over year in terms of our volume, and we are a referral center regionally and nationally for dual organ and triple organ transplant. Retransplantation is also on the rise, and we have a lot of experience partnering with our folks at Lurie Children's Hospital, patients who have undergone pediatric transplants, who have adult congenital heart disease. Those patients, they often need a retransplantation or they need adult congenital heart surgery once they've, reached adulthood. And so that is, I think, an advantage of being a high volume center that again has that comprehensive expertise.
Studies have shown over and over that outcomes are best at high-volume centers, whether it be transplantation, coronary bypasses, transcatheter valve implantations. And it's not so much the experience of that particular surgeon or interventionalist that's important. It's the institutional experience that matters the most, where you have experts in every field taking care of one particular patient coming in for a transplant or CABGs or valves. And that's where the mantra of a high-volume center being important is really holds true.
Having patients enter our program and make the process very seamless is something that Duck and I have been really focused on for the last few years, along with our program managers and our leadership. This is a really high-stakes time for patients, so we make it a priority to do telehealth consultations, review patients' charts, bring them in for an expedited visit so that we can really get patients listed, get patients through.
We are currently participating in a number of clinical trials for transplant patients to optimize the potential donor pools that they have available to them and increase their chances of getting a heart sooner. There's a bunch of patients that we could think of who benefit from our experience in both multidisciplinary as well as a high-volume center. Patients who've had previous congenital surgeries from childbirth or onward and now are living into their 30s and 40s, and the palliative therapies that they had as a child has worked well until this point, but now the heart's starting to fail. Some of these patients not only need new hearts, but they may have liver disease or kidney disease. And a center like ours that can bring together experts in congenital heart surgery, transplantation, both from the heart, liver, kidney standpoint, really does matter. Cardiovascular disease is the number one killer of Americans. And quite frankly, that's the bottom line in that. And it's our mission here at Bloom Cardiovascular Institute to address that challenge.